Welcome to today's special event at eLotus. With over 200 years of hosting educational courses, eLotus is your trusted source for premium CU content, offering 900 courses, 250 speakers, and 3,500 hours of continuing education. My name is Donna Chow, your host and your moderator for today's class. Thank you for joining us. Today's webinar will be held from 2 to 4 p.m. Pacific Time. And before we begin, please set your chat preference to everyone. This is important for an interactive session. Questions may be asked using the Q&A box, and that will go directly to Dr. Chang. And after the webinar, a quiz will be available and an email will be sent to you when it's ready. We are excited to present today's webinar, Peripheral Neuropathy, Arthritis, Joint Pain, Hepatitis, Fatty Liver, Dr. Jimmy Chang's Herbal Master Sheet. Dr. Chang is a renowned expert in herbs and pulse diagnosis with over 40 years of clinical experience and having treated more than 500,000 patients. He has been exclusively supplied by Evergreen Herbs for an impressive 25 years, making them the perfect partner for his clinical practice and research. We are honored to have Evergreen Herbs as our sponsor for this webinar, given their commitment to quality and service. During the webinar, Dr. Chang will share his extensive knowledge in pulse diagnosis and herbal prescription, with a particular focus on his unique herbal combinations. You will gain valuable insights into pulse indications for specific conditions and learn how to prescribe herbal formulas effectively. Dr. Chang has previously conducted several courses for us, which are now available as distant learning CEU videos. For those interested in enhancing their pulse diagnosis and herbal skills, Dr. Chang is the go-to expert. We highly recommend the Gold Pass membership, offering unlimited access to his foundational pulse courses and herbs prior to 2020. And as a special offer, the Gold Pass includes an herb voucher provided by our sponsor, Evergreen Herbs, allowing you to experience the mentioned herbs firsthand. This incredible value is perfect for those serious about mastering herbs. For more information, feel free to check the chat room, where we'll provide additional details. All right, so let's go ahead and begin today's class with a brief overview of Dr. Chang's herbal approach, ensuring everyone stays on track. If you're a longtime student, feel free to review or take a 5-minute break. Dr. Chang's herbal style differs from traditional methods taught in schools. He exclusively uses extract powders from evergreen herbs, offering around 300 single herbs and 100 formulas. In his pharmacy, Dr. Chang has approximately 150 single herbs and formulas combined. And you can find more information about his pharmacy in the YouTube video linked in your lecture notes. For those interested in starting a pharmacy like Dr. Chang's, Evergreen Herbs is currently offering a 15% webinar discount on the essentials of Dr. Chang's pharmacy. You can find the link in the chat room or refer to your lecture notes for details. Formula evolution is a key aspect of Dr. Chang's practice. He creates his own formulations, giving them names based on their purpose. These formulas may change over time as he sees more patients and makes modifications. Updated formulas are denoted with a 2.0 to indicate a new version. Fangjia Fang, which stands for formula plus formula, involves combining different formulas to achieve enhanced effects. Evergreen's extract formulas are decocted and extracted together, rather than just combining individual herbs. For a more detailed explanation on Fangjia Fang, Dr. John Chang has a video explaining the concept in more detail. Dr. Chang's herbal prescription is typically comes in 100-gram bottles, though for non-local or chronic conditions, 150-gram bottles are prescribed, which also offer the patients a discount. The recommended dosage for a 100-gram bottle is 3 spoons, 2 to 3 times a day. When reading Dr. Chang's prescription, if he lists herbs followed by a number, it means that all the herbs before that number are in that percentage. For example, in Sleep Combo 2.0, 酸枣仁汤 is at 40, while Yi Zhao Teng, He Huan Pi, and Zi Tong Yan are at 20. Can you tell me how many grams he would use if for He Huan Pi? If the total amount is 100 grams, how many grams would He Huan Pi be? Go ahead and type it into the chat room. All right, so did anyone answer 20 grams? Because if you did, you got it right. Congratulations. All right, so regarding mixing herbs yourself, it is definitely an option and you're more than welcome to. Some herbs such as circulation, sanjiao, and astringent are already pre-mixed as collection formulas in Evergreen's proprietary line. However, many new formulas are not pre-mixed yet, as Dr. Chang is still customizing them. So feel free to mix your own concoctions or use Dr. Chang's formulas as a base to create your very own. All right, so that concludes my short introduction. Let's go ahead and welcome Dr. Chang to take over the class. Dr. Chang, go ahead and share your presentation now.
Can you hear me now? What? Okay, we begin. Hi guys, this is Jimmy Chang again. Today I'm very happy. Today is August 16, 2023. I'm very happy to be here to discuss or share with you some of my experience using Chinese herbs for treating the peripheral neuropathy, arthritis, hepatitis, and everything. Yeah, arthritis is more common. You can see it every day in your daily practice, and that's what I'm seeing right every day here. Lots of people asking for a treatment of the pain. So let's begin. Okay, that's my. Do I have to mix herb myself? Yes, some of them is, I have my own combination, and some of them pre-mixed by Tina, so you simply order it, that is okay. And what does it mean, Fang Jia Fang, that beautiful lady just told you? Fang Jia Fang means formula plus formula. I just put them all together, like I'm cooking or something, put salt, sweets, sugar, vinegar into one pot and mix it, just like that. It's no big deal. Okay. Usually in my office, my procedure is I look at the palm. I look at the palm first, and look at this wrist area, and somehow we can find a lot of information there already. And then I ask him to put a hand on my pillow, and I start taking the pulse. But I know some of you do not do this. Yeah, some people always have to ask, oh, what can I do for today? What seems to be the problem? I do not ask them. I do my procedure, and of course, the most important is the ear signs. After reading all that information, I just ask them, what do you want me to do for today? That's all I ask. And but not everybody wanted it or could do that. So let's pretend. Let's say that there's a male guy. I'm sorry. Complaining about the back pain. You're lucky. You have already have the question. All you have to do to find the answer. Why this guy is suffering from the back pain? Could it be the old injury, or the new injury, or the new car accident, or disc pressure, like a bone spur, or simply the pain was caused by a kidney stone, or if it's a lady, it could be the result of a prolapse uterus or cyst, or something swollen in the abdomen area, like fibroid, something which already almost every time it will cause the back pain. So now is our job to find out the reason for his back pain. But anyway, you're lucky. He already told you what he wanted. What would you do? Do that. For example, this area, this is the hip. So you see the hip area? It's dark. It's dark. And so I always use this Sentong Zuyu Tang to take care of it. See the darkness there? And this grooves means sleeping disorder. And this is the head. And this is the gallbladder. This is the skin allergy. And this is abdomen. Some dead blood. Even if it's a male, there's some blood stagnation in the abdomen area. And this definitely the back pain. So by looking at this color, then you know the nature of this back pain is blood stagnation. So usually I will use this 生痛足瘀汤。生 means body, 痛 means pain, 足 means expel, 瘀 means stagnation, dead blood. So this is just an example. We've got a lot to come. Everything is based on my 45 years experience. Okay, you can see this too. This is the hip. So the hip is red. So the inflammation is definitely there. This is the sciatica. And this, see the string of bees? That's uric acid. This guy must have some gout. And this area, if it's a lady, this area is the breast. The breast, you have to check the both ear. If one ear in this section is red, the other section is red, and then the other part is dark brown. So one black, one dark brown, one red on the breast area. That could mean breast cancer. Be careful. I always warn the lady, you have better do it better. A mammogram. Oh, so I already did a mammogram. It's okay. Next time, try the ultrasound. I saved at least 6 ladies' life by saying that. And this is the hip, also the inflammation there, abdominal area. Oh, this is neck and shoulder. See, it's all red. So it's the inflammation. The treatment strategy might be a little bit different. And see, this is the inner ear of this area. With the inflammation, this guy or this lady definitely will have some vertigo, dizziness. So let's start with the peripheral neuropathy. The 周遭神经病变. Today we are bilingual. By the request of some of our members want me to say something in Chinese. Okay. Feeling the numbness, tingling or prickling sensation in the feet or hand that may spread over the leg and arms. So all the small ends, I always say small ends. Actually, by looking at the palm, you can tell a little bit about the small ends. If the tip of the finger are red, you can tell the peripheral area is inflammation. If the fingertip is too small, then you can tell his peripheral circulus is terrible. Or this area is dark and brownish, that means, especially you can look at the fingernails. Somebody has dark brown lines on the fingernails, straight lines, dark. Then you can tell definitely without even having to take the pulse, then you know that his peripheral area is stuck, blockage. Then you want to touch this guy's hand, no matter he's big or strong, or the lady. If it's freezing cold, then you have a general idea something gotta be the peripheral stuff 啊。这个脚或手会感到麻木、刺痛，然后到这个肩膀的痛或者烧灼痛。你看这个指甲如果黑黑的，就是淤血；指甲手指头肿肿的，就是发炎啊。So I usually this formula is my favorite, 生痛足瘀汤。So this is for blood stagnation, for blood stagnation, and this pair is totally essential. You must have it. If you don't have it, you order 10 bottles or 20 bottles from Tina now. And this one, the proportion is 50% and 25%, 25% to make 100%. I do 150 grams for the patient, so you can adjust the this like 75 cents or something. And how do we take the herbs? I never realized that a lot of acupuncturists didn't know how to address the patients to take the herbs and the dosage. For a grown man, I would do 3 times 8. I mean, 3 times 8 grams each time. Sorry. And by warm water after meal or before meal, doesn't matter. If it's too little, and there's no effect. So this is what I do for general people. So The 生痛足浴汤, I order a lot from Tina. It's very good for all kind of a joint pain, circulation. Even you're not so sure about the diagnosis, you just simply use it along with this. And for another great tip, if the pulse or the signs of the fingernail, fingertips, and ear signs, we'll talk about ear signs later. If it's all red, inflammation, you can simply replace this one with my astringent complex. Astringent is so good for inflammation, and put them all together, you can get a good result in less than a week. Okay?
Dr. Chang, can you hear me?
Tina, I cannot hear her.
Oh, you cannot hear me?
Hold on, I cannot hear you. Quiet.
Sam is gonna turn on the microphone for you. Can everybody hear me?
Tina?
Can you type yes in the chat room? If you can hear me? Great. I'm gonna help with moderating and ask questions so you guys can better learn the formulas. Okay, Dr. Chang does buy a lot of 生痛足浴汤 from us.
Yeah.
So
I'm using this.
So Dr. Chang.
It's working. Is it working? But I cannot hear Tina.
So when would you use 生痛足浴汤 versus 舒筋活血汤?
How about now?
舒筋活血汤.
Tina, I cannot hear you.
Okay. How about now? Can you hear me now?
No, it's just his headphone that he's using. Hold on.
Yes, X50. Yes.
Technology with the earbud. Those earbuds give me a headache. I don't know why. Maybe.
Hello? Just do.
Hello?
No, I cannot hear.
This one not working.
What do you mean it's working?
Right now testing, it's not working.
This is your earring, Dr. Chang.
I know about the mic working, but no headphone not working.
It's Tina's problem, not
No. We can't hear her.
Okay, I'll try this.
Okay, anyway, I'll type it down. When, you know, Dr. Chang has all these really good formula he uses a lot in his clinic. So to better understand why he uses certain, why he picks certain formulas, that will give you a guideline to distinguish the subtle difference.
I can hear it, Tina, but it's very blurry.
Okay. So we can learn the subtle differences between the formulas.
Okay, I can hear it.
So this way, when we're looking at our pharmacy, we would know.
Make it louder.
When we write out a certain formula, for example, what can be used as a substitute better. So, all right, we have some advanced students here. So can you hear me, Dr. Chang?
Yeah, I can hear you now.
Okay, great. Can you tell us why you pick 生痛足浴汤 and not 舒筋活血汤?
I don't know. I like this one better.
Sometimes, okay, this is honest answer from a advanced practitioner. Because,
45 years of experience.
Right. Sometimes it's because of this. I'll tell you honestly. When two formulas are very similar in function, it's the reason why they pick the certain formula is because of the price. It is a cheaper price. That's a possibility. Right, Dr. Chang? When we can use a formula that is...
With the money.
No, I mean, if we can achieve the same purpose at a lesser cost, why not? You can pass on the saving to the patient too, if you like.
Yeah.
So, okay, 生痛足浴汤, 舒筋活血汤 is about the same.
Yeah.
Okay, great. And how about for those people who haven't heard this who are new, when would you use 四逆汤 versus 生痛足浴汤?
Yeah, no. It's not the replacement. 四逆汤 is for circulation, to push the circulation to the extremities, to the peripheral nerve system, because some people are weak, anemic, and cold on their hand and feet, especially those ladies. They have no circulation at all. They're so picky about their food and no exercise. Their blood pressure was very, very low. So that's the time I would add like 20% of 四逆汤 to push the medicine through the extremities.
Okay, you guys got that? So, 生痛足浴汤 for regular patients. If you show weakness and cold, use 四逆汤 a bit.
Okay.